Can cancer be prevented? Let's talk honestly. So before that, I would like to introduce myself. I am Dr. Priya Nayak, Senior Consultant and Lead Medical Oncologist, Some Ultimate Medicare. So what happens when people on whom cancer gets diagnosed, they get very scared. So fear is very normal, but I would say that there are up to 50 to 60% of cancers are preventable. So what are the factors which leads to cancer, which are risk factors of cancer, and what can we do to prevent the cancer? So we'll mainly discuss on that thing today. So what happens if we see tobacco is the most important factor leading to cancer. It not only leads to oral cancer, but it leads to lung cancer, food pipe cancer, that is stomach and esophageal cancer, bladder cancer, pancreatic cancer, and we can have all types of cancer, gallbladder cancer, all types of cancer from head to toe due to smoking or tobacco. So that should be prevented. Again, the second most common cause of cancer we can say alcohol. So alcohol can lead to various types of cancer. Maybe it can be like oral cancer, or it can be esophageal or stomach cancer, or bladder cancer, etc. Third most common cause of cancer is obesity. This obesity is a cause which we discuss very less. Obesity leads to inflammatory production in our body, which can lead to various types of cancer. Again, lifestyle factors like exercise, or less amount of junk food, or taking healthy cooked meals, and dietary restrictions on taking diet with a proper calorie evaluation, that leads to a proper weight management. Along with that, it decreases the risk of cancer. Again, the vaccination is the most important thing which can prevent cancer. We have HPV vaccination, that is vaccination for human papillomavirus. Human papillomavirus is basically the most important causative agent of cervical cancer. So by vaccinating ourselves for HPV, we can prevent from 95 to 98% of cervical cancer. So we need to know the right age for vaccination. The vaccination is most effective before the female has sexual intercourse. So maybe from age 9 to 26 is the most good age to vaccinate oneself for HPV. But one can also vaccinate up to the age of 45 if she has not gone for any sexual intercourse till that age. Now again, we have HBV, hepatitis B vaccination. So by vaccinating ourselves with hepatitis B vaccine, we can prevent liver cancer. We will discuss about the most common important factor which will lead to early diagnosis, that is screening. Screening is we can define screening as diagnosing cancer before symptoms appear. So it is a very powerful tool. So by knowing the screening techniques that are available in various types of cancer, pick up cancer at a very early stage. So by picking up cancer at very early stage, can be a curable stage for most of the cancer, we can totally get ourselves cured from cancer. So hypertension and diabetes, we need to receive treatment lifelong. But if diagnosed at early stage, we can treat ourselves completely. That is a very good news for cancer. So the various screening techniques that are available are mammography and breast self-examination. Like for breast cancer, we have for colorectal cancer, we have colonoscopy, sigmoidoscopy, which has to be done at right age. Again, for cervical cancer, we can get our HPV testing, that is pap testing, HPV and pap testing done, so that we can pick up any preliminary changes that is happening for cervical cancer. Again, there are other screening tests for oral cancer. Who are tobacco chewers, they should get their routine checkup orally. Again, for the patients, chronic smokers, they should visit regularly to look for lung cancer if any is happening. They should get the regular scans, whatever advised. So these are very powerful tools. That is prevention and screening techniques which one should know. Again, I would say there is no some magic diet or magic detox drink or some magic formula to prevent cancer. So it is healthy lifestyle which can actually help us in preventing cancer. Like it can be avoiding alcohol, avoiding smoking, or always choosing a healthier option when we have some bad and good options available. So that would prevent cancer in a very large scale. Again, getting oneself vaccinated wherever vaccination is available, that can again lead to cancer prevention. So again, I would say all of you that if cancer is diagnosed, that is not that we are going to be blamed. So whenever cancer is diagnosed without any risk factors, we should generally go to doctors and checked, get ours. We should discuss with the doctors about various treatment options available about the stage, so that we can cure ourselves, or at least we can receive proper treatment so that the longevity or lifespan can be increased, or we can at least have a very good quality of life. So whenever cancer is diagnosed, we should go and visit a doctor for a better treatment. So my last message for all my viewers is that we should know about the various healthy lifestyle that is available. We should adopt a healthy lifestyle. Again, we should get ourselves vaccinated. We should get ourselves screened so that we can prevent cancer wherever possible, or we can actually get ourselves diagnosed at initial stage so that treatment is possible or cure is possible. Thank you.